Starting. All attendees are in listen-only mode.
Good afternoon. Today is April 2nd. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Friday series of DDA updates with Bernie Simons, the Deputy Secretary for DDA. We'll also be hearing from Dr. Lisa Hovermale, Psychiatrist, and Dustin Wright, Disability Cacoon. We have Patricia Sestoki, Director of Programs, and Rhonda Workman, Director of Federal Programs with us. And before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two handouts for the webinar, and you can find them in the handout section in the panel to your right, and they can also be emailed upon request. We will be recording the webinar and posting the YouTube link on the DDA website. Questions can be typed in the question or chat box in the webinar panel, and we will answer those towards the end of the presentation. So now I'd like to introduce Deputy Secretary Simons. Good afternoon.
Good afternoon, and welcome everybody to this webinar again as we continue to move forward. Today we've got the opportunity to have with us, many of you may know Dr. Lisa Hovermale, who is was with Behavioral Health Administration and was the liaison for DDA, and then back a few years ago was assigned full-time to DDA. I think we're very fortunate to have Dr. Hovermale engaged with us in the state because she has extensive experience in intellectual and developmental disabilities and people with psychiatric issues. It's a rare psychiatrist who has that talent, that background, and that experience. So we are very fortunate to have her here today. She's going to talk a little bit about reopening. We know in March of last year, when the pandemic hit and we basically had to close immediately, like flipping a switch. We knew that there were all kinds of issues going around with COVID-19. But as you know, there's discussion, and you can see that even I think a little while ago, the CDC even put out that if people who are fully vaccinated, they can travel. Now that's what they're saying. We got to see what our governor says and what his interpretation is and what he has done, specifically about his press conferences, and I'll talk about that a little bit later. We're also fortunate to have with us Dustin Wright, who basically is the founder of the Disability Cacoon. And the reason that we've asked Mr. Wright to come with us today is some of us were with People on the Go a few years ago in the self-advocacy group from DC, where they did a joint meeting and had Dustin talk about where are we going, what's the future look like with technology. We know with being in the pandemic and then people not necessarily going out into their day programs, that people did a lot of interactions and interventions remotely. We've got a lot of feedback that people don't want to go back to some of the legacy type services, and that they're looking forward to continuing with remote services and supports. And I think that it's a good opportunity for we in the state of Maryland to move forward and think about becoming a technology first state, like we've done with our employment first. So next slide. So again, our highest priority is working for everybody's safety, you know, continuing to give us feedback so we can make these webinars as meaningful and continue to talk about everybody's health and well-being, but also where we are about vaccinations and some other things that we will get to. And again, I want to thank everybody for practicing social distance, washing your hands, and limiting the amount of social gatherings. Again, this is our highest priority. We are all one DDA community within the larger community of the state of Maryland. So I think we need to continue to stay in touch with each other through these webinars and giving us feedback from DDA about what is relevant and what you would like to hear about. Next slide, please. We've been posting monthly communications. Hopefully people have seen those, and obviously they're on the screen here. I'm not going to go through and read them, but you know, we've done highlights monthly, January, February, March, and then we did a quarterly update on our transformation newsletter. So I would hope that you would take the opportunity to look at that on our website and basically see if there is anything that rises to the occasion that you want further clarity on, or further information, or we need to have further discussion with our DVA community of individuals, families, providers, etc. So next slide. So as I mentioned a few seconds ago, Governor Hogan did have a press conference this week, and Maryland has surpassed 75% of the people who are 65 and older who would get at least one dose of the COVID vaccine, and we are ahead of 30 other states. So I think that everybody in the Department of Health and the local health departments has done an outstanding job. I think the providers have done a great job with us here. And as you can see, phase 1, 2A, and 2B are all eligible to pre-register for an appointment with the mass vaccine, and also with the federal site at Prince George's County that I think is being run by FEMA, if I recall that correctly. Next slide, please. So we are, as you see, in 2B as the press conference that was shared yesterday, March 30th. And we had the 2B, so anybody 16 or older with underlying medical conditions or disabilities with an increased risk are now eligible for vaccination. And the governor said immediately that there was a launching of a pre-registration for all people at covid.maryland.gov, and that people who are currently eligible in phase 1 and phase 2 will continue to be the prioritization at these sites as we continue to move forward. Next slide. So we continue to work with our sister administration, Public Health, and with the Department of Disabilities to coordinate disability-specific clinics as more vaccines become available. And I want to thank all of the providers who have hosted these vaccine clinics. It takes a lot of coordination, a lot of work, a lot of communication to run these to be successful clinics, and you've done an outstanding job in assisting people to get their vaccine, people in supports, family members, staff. So this has been a truly amazing collaborative effort that I think everybody has done a really, really great and outstanding job. Next slide. So before I start reporting on our numbers like we usually do with this, I again want to say how grateful I am to all the leadership and the agencies who are currently hosted or will be hosting in the future, because we know we've got some of those coming up, and it's not easy to do. It's a major task with coordination and getting volunteers and being patient with how things are going, or hopefully they run smoothly, but things don't always go as well planned as we would like to. So you need to do a little correction during on the fly when you're doing this. But again, all of the feedback that I get is absolutely wonderful, and I applaud you for everything you've done and moving forward with assisting all of the people within our supports. And so let me give you some updated numbers like we usually do on these webinars. So as of a couple of weeks ago, March 18th, we had in the central region 859 confirmed positive cases of people in supports. 1,222 were negative, 5 pending, and we have had 53 people in support who have passed. In the East region, 150 are confirmed positive, 416 negative, 0 pending, and 6 people who have passed away. The South region, 620 positive, 228 negative, 3 pending. And we've had 26 people pass away. And in the West region, we've had 366 positive, 401 negative, 0 pending, and 17 people who have passed away. To look at our direct support staff, we've had in the South region 414 positive and 5 people have passed. West is 205 and positive and 2 people have passed. In the East region, there is 220 people have tested positive direct support, and 1 person has passed away. And in the Central region, it's 668 have tested positive, and 2 people have passed away. Next slide, please. So this is the information that we've been giving and updating as so longitudinal data. And you can see that we've got about 11% of the people who have tested positive. So the pie chart does illustrate the 1,700 and almost 1,800, a little short of that, which is about 89% of the people provide supports to, and about the number of people who have tested positive is 11%. So you can see that on the chart. On the right, you'll see what that looks like by positivity, and you can see that there has been a slight increase, not much. So again, congratulations that you've been doing well with getting people vaccinated and washing hands, social distance, etc. So we've gone from 0 in the East, 2 in the South, 5 and 9 in Central. So I think everybody has been doing an outstanding job, and please keep up the good work. I mean, we're not out of the woods yet. So anyway, next slide. So we also look at this tracking, and you can see that we start really on about March 4th, and we go through April 1st. And so obviously you can see this, and you can see that the positivity rate that's gone up, and we've had 94 deaths during that, from 94 deaths to 102 in total. But since our last meeting, there's only been 1 person who's passed away. Obviously, 1 too many, but when we keep everybody in our thoughts and in our prayers who have passed, either in our support services, direct support, or anybody in the nation who has had this terrible COVID-19 and has had less than positive results, and we keep them in our prayers and their family members, as well as our TDA family, etc. So we need to keep thinking about this and keep positive that we're going to do this and we're going to get through it. We've been doing it now since March of last year, so we're well over a year into this, and hopefully with the vaccinations coming in and the announcement that the governor's doing, and the mass vaccination sites and the vaccination sites that the providers have had, that we'll be on the right track. Next slide. So we obviously look at not just people who are in traditional services, but people who are in self-directed services, and you can see that some of the numbers that we have, we've got 36 positive cases that we're aware of, and we've had 0 deaths. So we'll continue to engage people who self-direct, and make sure that they get invited. And I want to compliment some of the providers who have done vaccination sites that have reached out to people within those regions who have been self-directed. Next slide, please. So we've asked the providers to basically tell us the number of participants that they plan on to get vaccinated, and the numbers that are currently vaccinated. You can see that on the numbers on this slide. Again, I asked the providers that please continue to update the information that we have asked for on a weekly basis on vaccination tracking. We've got 13,000 showing the 500 basically showing there, and we know we've got about 18,000 people in our waivers. So I'd ask you to continue to give us information so that we can get to 100% of our participants and have a sense of where we are. I do want to congratulate everybody again for the 115 vaccination clinics that were already held, and there's 12 that are currently scheduled. So as we continue to move along, everybody is doing an outstanding job. But again, I can't stress enough, I'd like to see the 13,000 go up to close to all of our participants and where we are with that. So we have been doing this tracking, as I mentioned earlier. And as you can see, we track family members at age 60 and administrative staff and, the number of direct care and the number of participants in SDS. So, we look at all of this. And again, I encourage you to work with us so that we can, early on, we were doing the tracking with people who were testing positive and people were testing negative or pending, or unfortunately people passed away that we did in a few slides earlier. But now we need to say, where are we with being successful with people being vaccinated, and how do we move forward and get all of this good data. And so with this, I am going to stop now. I want to thank you for all of your advocacy efforts and also for attending these webinars. And with that, I'm going to ask our psychiatrist from the DDA, Dr. Hovermale, to take over. So thank you, Dr. Hovermale.
My pleasure. Can you hear me okay? Everybody hear me fine? I'll assume so. So, great. I want to say how pleased I am to be here and thankful for the opportunity. As you've already heard, the big emphasis has been on vaccination and getting everybody protected against the virus. But we're also, in our state, as well as the whole country, beginning to think about what comes after this. How do we get back to some kind of new future that we haven't quite imagined yet? Everything changed a year ago. It was like a click of a button. It's like we suddenly changed channels and we were seeing a whole new reality, a whole new routine. People had to make sudden changes that really cut them off from the interactions with the world. Now, a year later, we can see where we've been. We've already seen that show, and we can guess what the next show is going to be like. In fact, we can use the information that we have learned from this year and sort of plan a whole new future, one that we prefer to what has been going on for this past year. So we need to imagine what our new routine will be. And I don't know about you, but for me, it feels like, this clicker has had us on pause as well for the last year. There were things that we were planning and expecting to do, and that did not come. And I'm hoping that we can get back to some of that future and put some of those plans back in place that were going to happen before we had to pause and pivot and go in a different direction. Next slide. So for the last 11 months, we've had to do all this stuff. We've had to wear face masks and all the social distancing and PPE, telecommuting, and we had to stay at home to figure out how to make all the basics of life work. By the way, I just read an editorial acknowledging how many people with DD work in jobs as essential employees and the important contributions they've made. Don't hear enough about that, so I thought I'd mention it. We all want to breathe a sigh of relief now that the vaccine is here and there's more hope for something normal in the future for us. Of course, we all know that things won't be exactly the same. Hand washing, social distancing, and masks aren't going away anytime soon. And we can't declare victory at this point, but things are loosening up a bit. Yet, what they teach you in psychiatry school is that any change is a challenge, even if it's a change for the better. There are losses and gains with everything when you change. So for some people, there's likely to be continuing and worry and discomfort about safety as we all slowly return to a more usual community involvement. Everyone's routine will have to be crafted to them using that person's circle of support and considering everyone's specific needs. Next slide. But the good news is that we can leave the clicker metaphor behind here, that we don't have to do anything with the click of a button again. We don't have to suddenly change back to in the direction we were going before. We have time to be flexible, but I think we all know we have a very complex system. I've put out here on this slide a few elements of our system, but even that's an oversimplification. It's really just a starting point for the discussion about how our system interacts. I think everyone already knows that no one level of the system can see the whole picture all of the time. So it's critical that the levels communicate throughout the levels. We all have to stay in constant communication, which is one of the functions of these webinars. Have been a great contribution to everyone staying in the know. There are a lot of smart people out there who've already started to think about reintegration. And that's not just in our state, that's in the whole country. And we want to make sure we share the best ideas and try and get everybody to have the best plan they can possibly have. I'm going to try and share a few ideas today just to prime the pump. I can't possibly have the full picture. So I don't expect to cover all of the potentials, but I hope to capture some of the big ones. Next slide. Given the work that I do, the best contribution I can make is to concentrate on the needs of the individual, and for the younger set, the needs of the family unit. I want to put a big shout out here to people on the go. They were very generous in allowing me to come to Zoom into one of their meetings and spend some time with me, sharing their ideas about this topic. And I think that one of the things that I learned from meeting with them, that they were so generous to share with me, is that people want to know, what are the rules? People want to make choices, but they need the best information they can get before they can make the best choice for themselves. So the answer is we all have time to be flexible, but the best guidance we can provide needs to be provided as quickly as we can provide it. People want to know, is it going to be safe? Do I have to go back all at once? Or do I have to go back at all? How do I get where I'm going? How many people will be on the van? Are these conversations, these are all conversations that people need to have as their individual plan is crafted and created. And in that individual plan, the individual's individual comfort has to be addressed. So in the handout section, you will find what I think sounded like some pretty good ideas that Pennsylvania put together in their individual transition guide. You'll see there it's actually from May of 2020. So I think that guide might really be helpful as CCSs, coordinators of community services, began to work with their individual clients and asking specific questions about what they liked about the last year, what they didn't like about the last year, what they missed, and what challenges that they will face as they go back into the community in perhaps new and different ways. So as we communicate, I mean, this is also, we need to figure out how we're going to get this information back to the individual. Some agencies are able to post on their websites changes in policy or what measures they've taken, making that available to the individuals so they'll have the information to make their best possible choices. I know that our regional offices are now meeting with providers to frame questions that need asking, and then we'll have to decide on the guidance and how to get it to people as quickly as possible. Next slide. So right now, I'm only talking about our own system, which certainly has plenty of its own challenges and issues, not even beginning to talk about all the issues that are outside of our system. And what's the plan for schools, vaccine sites, accommodations in those sites? We're getting guidance from CDC. We're increased attention to underserved populations getting the vaccine. When I was meeting with people on the go, Maryland Disability Rights, Casey Shea was there talking with them about making sure people in independent living or living with their families were also getting access to the vaccine. Our AAG, Margaret Langford, is providing guidance on accommodation that need to be provided at mass vaccination sites. And society in general is tuning into the issues, and the right organizations are pushing in the right direction. But how do all of us manage our anxiety? I think the answer to that question is we control what we can control. We make choices using the best information we have, because otherwise we'd get emotionally overwhelmed. And a lot of us have gotten emotionally overwhelmed during this past year. We all know that everyone gets emotionally overwhelmed in their own particular way. When I get emotionally overwhelmed, I go to bed and cover my head with the covers and quietly moan to myself until I can get up. My circle of support knows that I need to be left alone when that's happening, but they also know not to go away, so they'll be there when I get up. Everybody has to have their own individual way of having their emotional response to these circumstances, and it's going to be different from person to person. So what we need to do is for each individual circle of support to know their person and know how best to help them and get them the help they need if they can't get it from the environment they're in at that time. I want to say a word about vaccine hesitancy. We don't want to, as people are validly concerned about these things, we don't want to gloss over or dismiss their concerns. We want to make sure people get the education and the information they need to make their best decision and find the answers that'll make them feel more comfortable about getting the vaccine. At the same time, it's without a doubt a good vaccine. I got it. And I think the science is very good, and I don't think there's any reason to be concerned about getting it. But again, it's an individual choice. So next slide. Okay. So I think this is kind of a summary slide. Oops. All right, I think I missed one. Can you go back one, Donna? Okay. Nope, that's not it. One more. Go forward. Okay. Oh, anyway, something's missing. Anyway, no worries. Right now, We remember people have been holding it together for over a year. For some people, beginning to let down might come with some emotional overflow. So we need to also support people as that and acknowledge their emotional, what do you call it? They're overwhelmed by the emotion that they've been holding in for so long. They need to vent that emotion, and we all need to accept that. We don't necessarily need to tamp down strong emotions as long as the person and those around them are safe. We need to make sure they aren't shamed for feeling or expressing these emotions. We need to not say things like don't cry or don't act like a child. First of all, most people, when they're having these emotional overflows, they know that they're not exactly at their best, and telling them that doesn't really help the situation. So we want to find ways that validates them, at the same time supports them, lets them know that their upset is seen and witnessed and understood by you. And sometimes that's the best gift that you can give someone, is to just witness and be present. Now, there may be other people who have behavioral supports that need to be crafted to them. For some, maybe a positive behavioral support environment will be enough, or maybe they might need more help to help them. Then the circle of support really needs to make sure that they get the help they need. Okay, so where are we now? All right. So we want to recognize the anxiety and possible fear. We also want to acknowledge, first of all, that for some people it hasn't been all bad. There have been some things they've liked about this year. They've liked staying home, and it has been comfortable and safe. So that's part of the package. We also have to acknowledge there have been some momentous losses, and those losses have to be dealt with. And that's not just the losses of the individuals and their families, that includes the losses for direct care professionals and the agencies, and there a lot of important people are not there anymore, and that loss is can't be undervalued. It needs to be acknowledged and addressed in whatever way that agency and those people feel confident or happy about. Maybe for some people it might be a ceremony, some other way to acknowledge that loss, but it definitely needs to be talked about, not swept under the rug. Referrals can always be made if that's what seems to be the best path forward. Okay. We have the next slide. So we also want to touch on the fact that, even if you haven't had a terrible loss, there's still trauma involved. I call it trauma with a small t, of not being able to go out, having to change your life, being isolated, being immobile, losing your sense of safety and perhaps your sense of purpose. And what can we do about that? And here we're going to go to the next slide, and we're going to reference that previous webinar that Karen Harvey did about what are the possible antidotes for being in those circumstances, and what can you actually do, because you want to control what you can control, so you're going to do what you can do. And here's some ideas about what things that you can do to make yourself be a little more in control of your life. It's important to, still try to connect with people using technology, and it sounds like we're going to hear more about that. It's important not to be immobile, but to continue to move and to engage in all kinds of safe practices to help yourself feel at least a part of the world, even if you're not with the world. It also makes a lot of sense to avoid a lot of news contact, because we know how that can go. So next slide. There have been a lot of creative ideas out there. We're all moving in what seems to be a really positive direction. there's a lot of things that are going to be changing in the future. And I really think that we're on a good launching pad, a good foundation to launch ourselves into a better future. And at the end of the next slide, I believe, is a list of resources that I want to give a big thank you and a shout out to Dr. Magdi Pasquale, who worked on a lot of these slides and accumulated these resources, and thank her for doing that. And she has put together this list for that might be useful to people as they're thinking about what to do next and how to move forward. So thank you very much for your time and attention. Appreciate the opportunity.
Okay, Dustin, you're up.
Great, thank you very much. That was some great information. Excited to be here today and hopefully shine a ray of hope, continuing on the kind of the theme of the last presentation and talking about a new initiative, maybe not exactly new, but a new initiative that is being started in the state of Maryland that is called the Technology First Project. My name is Dustin Wright. I'm with Disability Cacoon and will be assisting DDA through this process as I've helped some other states and some other local governments kind of get into that. And I wanted to first start with, before I give you a real quick background of myself and the project and some of the other resources that are going to be available, I thought I first should talk about why technology needs to be a big part of the discussion and how we provide supports and services to people with disabilities. And I'm going to make a big prediction, and it's a hypothesis. Don't have any real data behind it, but just seeing what's occurring across the US, my hypothesis is that technology will have the same impact on the way that people with disabilities receive services and the way that we provide services to people with disabilities that the deinstitutionalization movement of previous generations had. So for those of you that were involved in that, you can probably remember when people were largely living in institutions and the waiver programs were created, there was a lot of hesitancy and fear by people involved in providing those services that how are we going to keep these individuals safe when they're out living on their own in their own homes? How is this going to work? And we all know that the impact of that was significant in a very positive way for people. And I feel that technology will have that big of an impact in how we do things and how people receive services in the future. I do think it will be kind of the new phase, right? And you know, if there is a silver lining in COVID, it's that it did kind of force us as a disability system in Maryland and as well as across the US to begin using tech. And everybody's a little bit more familiar with Zoom and some of the other tools that we're using during these crazy times that we're living in. So I think tech will kind of become almost like the new norm, and it won't seem like it's something that is foreign to us when we're providing services. We're seeing more and more funding options. CMS has been very supportive in state waiver amendments that increase funding, long-term waiver amendments. Obviously, Appendix K was, pretty much opened the floodgates for tech availability. But in long-term waiver amendments, we're seeing CMS be very supportive of states, and many states are funding technologies in lots of ways, including Maryland. We're also going to, I think tech will be a great tool. One of the tools, it won't be, the only tool, but one tool to help providers address the workforce shortages that are just endemic in our system and have been around for, decades, and obviously doesn't appear to be getting any better. Tech will allow us to reduce the reliance on the number of DSPs that will be needed to provide support. I'm not saying by any stretch of the imagination replace. DSPs will always have a very important role in serving people, but tech will allow us to do it with fewer of them. Also, workforce expectations are changing. The generation that we are primarily hiring right now in that DSP role have all grown up with technology in their hands, and their, social media, Instagram, Snapchat, TikTok, those kind, that's how they live their lives. And if they see an organization or a system that doesn't embrace the use of technology the way that they do in their life, it's going to feel very foreign to them and just make recruiting those folks even more difficult. They'll go to other industries and other companies that are a little bit more tech progressive that they feel, kind of that resonates with them. It's also, as a former DSP myself, it's also going to allow us to refocus supports. As a former DSP, I remember 20%, 30% of my time and energy and focus was on doing, things because of regulatory compliance issues and documentation. And that stuff is very important. I'm not saying it's not, but tech will allow us to kind of, I don't want to say automate those things, but allow us to refocus our attention and energy on the person that we're serving so that the person has much better outcomes. It's also going to give us lots of data and insights into things that we just don't see today. As homes get smart, people are using apps that help them navigate the community. Well, you're going to get all kinds of data that will allow us to do things better and do things more efficiently with less waste within the system, which ultimately means cost savings within the waiver systems that then can serve more individuals and more people can get the stuff that they need. And you can forget basically everything that I've said so far, because if we don't keep the individual's focus as we're doing tech on the person and their desired goals and outcomes, then that other stuff is not going to happen. If we stay focused on the outcomes of the person, then those other benefits that I've been talking about will also occur. So on the next slide, I'm sorry, we can keep it here for a second. Just wanted to give you guys, so you know who I am and kind of the role that I'm going to be playing as part of this tech first push in Maryland. As I mentioned, I started as a DSP in this industry, so I've been there, done that. After graduating from college, I ran a provider organization for 4 or 5 years, supervising their Northern Indiana operations, waiver and ICF. Left there in 2006 and started a company called Rest Assured, which was the country's second remote support provider. Grew that company over 13 years as the executive director. And during that time, I realized that there was 2 big things that needed to occur for more tech adoption. One were regulatory environments and funding opportunities. It's a big barrier. So I worked very closely with several states in creating their remote support service definitions and fitting it into their waiver system so that we created win-win-win up solutions, and I'll describe that in a minute. I also realized that there was a big cultural barrier. There was lots of education and fear about using technology within the industry that also needed to be addressed. And there was not one entity that was really focused on the IDD service delivery system in the US and tech's impact. So that's why I created a company called Disability Cacoon, which I'm the founder of and president, where that's what we do. We are a technology resource hub and catalyst for change. And on the next slide, I wanted to talk just quickly about some of the resources and things that we're going to be bringing to Maryland through this Technology First initiative. So this is kind of an image showing all the things that we're doing at Disability Cacoon, and I'll talk through these very quickly here. But on the left-hand side is kind of the discover phase, where we help people discover new forms of technologies through a newsletter where we're talking about the various things that we're seeing across the US, a blog outlining best practices in utilization and applications of some of those, sharing lots of stories and inspiration and through social media. So that's just helping people to find out what's out there. We're also doing weekly webinars that we call Tech Huddles, where we invite a new tech company on every week. For 30 minutes, they get to talk about their tech and how it is applied to people with disabilities and the benefits of using that tech. Those are free to attend for anybody in the US. So it's just a great way to get exposed. We also do online workshops that are deep dives into a specific area or domain in a person's life. So as an example, community living. We do deep dives into technology around supporting people through community living. Or maybe we'll do a deep dive into a specific type of tech like medication administration tech. So those are our workshops where we try to get a little bit more detailed, and it's not just, hey, come see the new shiny objects and the latest, greatest tech. We really give people tools on how to use those things. Prior to COVID, we were holding Tech Fests, which are conferences around the US. We held 8 in 2019. Obviously 2020, we did 0, unfortunately. but looking forward to expand those again and hope to do some on the East Coast that maybe people in Maryland could take advantage of. Over the last year and a half, we've created an enabling technology certification program and agency accreditation program called SHIFT. This is an online learning community where we have courses in teaching people how to approach technology from a person-centered way. So giving them the tools and knowledge on how to do assessments, how to going from an assessment to identifying which technologies could be appropriate for that person, how to implement those and kind of best practices, and actually writing, the tech utilization into the person's plan of care, ISP, if you will. So that SHIFT is just launched and have several providers from around the US going through that right now. We also have curriculum for service coordinators as well within SHIFT. We have a partnership with a company called ATvisor that you can see there also. It's an Israeli-based company that has created an assistive technology search platform. But it's not search for a specific type of device, it's search for Bob needs help with this in his life. So you're searching for desired outcomes, including putting in Bob's needs, abilities, disabilities, diagnosis, that kind of thing, and it will spit out recommendations of technologies that might work for Bob that the team can then consider. And then we also do lots of other projects and presentations. Really excited to start working with DDA there in Maryland. We're helping the District of Columbia's DDS work through their Technology First initiative, help the state of Kansas and Tennessee as well with their kind of tech first pushes. So at a high level, that's what we do. You guys can go ahead and start taking advantage of all of this stuff that Disability Cocoon is doing. Most of it is free. And a lot of these resources will be available through the Tech First push there in Maryland. On the next slide, we are going to get into just a high-level overview of this Technology First project. Maryland has had a tech task force put together for some time that has been working. Excited to get back and start working with that amazing group that's a multidisciplinary group of people that will kind of drive this initiative. And one of the first things that the tech group will do, or the tech task force will do, is kind of an environmental scan, looking at current waiver regs and funding and other policies and procedural types of things, and seeing where are some barriers that are endemic in the system, where are some what are we missing, what could we add that would increase access to technology and creating opportunities for people to use tech. So out of that environmental scan, we will kind of see the deficits and some barriers that obviously the group will then create goals around addressing. We'll go create those goals, looking at all of the stakeholders within the system, from goals for outcomes for DDA, outcomes for service providers, outcomes for service coordinators, case managers, and obviously outcomes for the person that is going to be receiving services. So we'll create some very specific goals and tasks and work to knock down those barriers and create more opportunities. Along with that, we're also going to, as I alluded to earlier on, address some of the cultural issues that are just everywhere. Creating opportunities for education, learning, sharing success stories, and ensuring that best practices are done through some of the policies and future regulations that may come. And then we'll put together a communication plan so that people within the Maryland DD system can start to see some of these things, and the resources will be available and they'll know how to go get them. So the ultimate goal here is to knock down barriers for tech utilization, to improve the quality of lives for the people that receive services. So I'm extremely excited to be a part of this project. Working very closely with DDA, who's taking the lead on this, and hopefully I can maybe meet some of you in person as looks like things are improving with COVID. So thank you very much, and again, look forward to working with everyone. There's my contact information if you'd like to reach out. I'm happy to talk or answer questions or whatever. So thank you.
Dustin, thank you so much for that presentation, and just wanted to let people know that as Dustin said, we had a task force about 2 years ago that we started, and we will continue to work with that task force. But if there's any of you who would like to be a part of that group or are interested in being a part of a subgroup, please email Patricia Sestoki at maryland.gov, and be happy to reconnect with you and move forward with Dustin as he come into Maryland to do this. And we're going to partner up with the DC group as well. So we're going to open it up for questions. So Rhonda, can you lead us with the questions discussion, please?
Yep, absolutely, Patricia. Can you hear me okay?
Yeah, go ahead.
Okay. So first we had a comment when Bernie was presenting about the vaccinations and the clinics, just an acknowledgement, thanking DDA for being a part of the success and helping to get people vaccinated. But we also had another question, Patricia, that you could help us with. The question is, how will our communities be made aware of those other provider clinics that Bernie had mentioned?
Wonderful. Yes, usually we get all the information from our chief of staff, Tanya Ferguson. And what we do a couple of things. We partner with the providers. The providers usually put and share the information to all their participants and families in their website. We then share that information at the regional level, where the regional director shares this with families and participants. And we also post it on our social media on Facebook and give that information out there. So if you follow us through Facebook or through Constant Contacts, that's a way of doing that. And if we know ahead of time, we'll put them in our webinars like we did in the March 19 webinar, where we told you about the other clinics that we had. So we'll continue to do that as clinics continue to be hosted, and specifically the mass vaccinations for our population specific.
Thank you, Patricia. We had a question that says, currently many of DDA supports for services like our supported living and community development services outside of Appendix K don't support people having their supports remotely. Will these services be funded under the same funding model as in-person supports? And so just to provide some guidance or some additional information on that, currently in the DDA waivers and with the approval of Amendment number 3, remote support services can be used to support supported living. And as noted with Amendment number 3, we have added virtual supports to several of our waiver services as another service model option for people outside of Appendix K. So when Appendix K ends, these options will continue, including for our employment services, supported employment services, community development services, day habilitation services, and personal support services. And additional information about Appendix K and virtual supports can be reviewed on our What's New webpage related to Amendment number 3. The next question is, are these slides from Dustin part of handouts, or do I need to screen print one as I want to keep?
No, they are actually a handout under your right hand panel of your screen. There's a little section that says handouts, and it's a 2 of 5. In there, we have this presentation, and we also have the resource that Dr. Hovermale shared. And if you need assistance with that, or you can't download it, or for some reason you can't print, please email us and we'll be happy to send it to you.
Thank you, Patricia. There's a comment related to the Technology First initiative. It says, wow, so much gratitude to DDA for initiating this. This is wonderful and so needed. The next question or comment is, Disability Cacoon sounds exactly like health risk screening tool. It is going to put more work on agencies and nurses. How will this affect current processes?
Dustin, you want to talk a little bit about what you've been doing with other states? When we're, and I'll start a little bit, when the purpose for becoming a technology first is to really have a best communities of practice. It is not only DDA, but it would be the Department of Disabilities, it would be DOORS, it would be MSDE, it would be the providers, and how do we make sure that technology and assistive devices are available to a person based on their need and being focused on their outcome and what they want. Our job is to make sure that everybody is fully informed and know where to go to those resources. So it's not a screening, it's not an assessment, it's not any of that. It's saying, this is where you go if you have a person in your caseload or in your program or a family member who may need assistance because they want to do A, B, C, D, and they can't and need some supports. What's out there outside of a human being doing it on or for behalf of that person? So Dustin, do you want to add to that?
Yeah, I think that what you said is exactly right, and I completely understand this person's concern. And I think that the amazing task force that has already been put together is going to be multidisciplinary. So we have people that are looking at that through the lens of you, whomever asked that question, and ensuring that we're not creating additional problems or additional work, that we're only creating opportunities. And you know, as we start to work on this, the group will look at process and policies that will hopefully not cause you any more headaches.
Great, thank you.
Rhonda, the other thing that I want to say that people may not know is Dustin has been very instrumental across the country to make sure that when states are writing waivers or amendments, that we're doing a crosswalk to make sure that we have the proper language and supports related to assistive technology.
Thank you, Patricia. The next comment question says, will self-directed service representation be included on the technology work group? Has Disability Cocoon been advised to also consider self-directed participants in the work they are doing for DDA in Maryland?
Absolutely, absolutely.
The next question is, will music therapy programs be part of tech project?
I think, I think that is a great question. I think technology is based on a person's need and outcome. I think we have to probably dig deep into more of the question about what about it or what kind of supports. Dustin, do you want to add to that?
Yes, I mean, the only thing that I wanted to add is that, as a part of writing or potentially amending current waiver definitions, is we want to keep the language open and as open and flexible as possible, because technology is changing so fast that our regulations can't keep up with it. And if we get too prescriptive in our regulations, then we're limiting people in their options. So I believe that there could be a way that some of those types of things could be funded, but again, we're a little early in the conversation there. So.
Thanks, Dustin. I just want to let the group know I'm already getting emails of people saying that they know you and they work with you in the past, Dustin, and they want to be part of the committee of the tech group. Great, thank you.
Outstanding.
Okay, couple other ones. Is there intention for this, the technology first effort, to start being required in the PCPs?
I think I don't want to use the word requirement. I think it's something about person-centered. It's about person's assessed needs and anything that would enhance and support that person meet their quality of life and they're projected to a good life. I mean, I don't think DDA is going to put regulations and requirements. I think it's based on the person.
Thank you. Dustin, another person wanted to know if you could share some other states that Disability Cocoon is working in. They noted you mentioned DC, Kansas, and Tennessee. Is there any other ones you can share with us?
Yes, I've worked with several states. Wisconsin is one. West Virginia, I helped them write their remote support regulation. Kansas was a local, it was a Sedgwick County board. And they serve the Wichita area. Montana, I went out there and helped them craft their remote support language. So several states.
Ohio,
yeah, Ohio, absolutely.
And I just wanted to acknowledge that we did get some questions from some of the attendees related to topics that we're not talking about today. the ERA updates, retainer guidance, and our new Director of Fiscal Services and Operation, Robert White, is reviewing that information and will be sharing updates soon with us. That being said, I don't see, let's see, one other comment. Technology First in Maryland will be looking at electronic and assistive technology or just electronic.
Patricia, you want me to jump on that?
This is Bernie. Let me respond to that. You know, during this pandemic, we basically have seen a lot of people want remote supports, etc. I think historically that when we've looked at assistive technology and some of the utilization within our waivers, it's been around remodeling of the home and or ramps and stuff like that. I think we need to expand our imagination, and which is why, you know, we have this work group, why we've invited Dustin to come in and work with us and share his experience in other states. If you look on Ohio Department of Disability Services website, you will see that back a couple of years ago, they became a technology first state. So, you know, I mean, they use robots and all kinds of things. And I think where we're positioned here in the state, you know, when we've got a lot of resources that are here that are, you know, biomedical technology services and, you know, all kinds of labs and stuff. I think the limitation is going to be in our imagination. And so, you know, in my mind, the sky's the limit. It's not limited to just one facet of assistive technology.
So Bernie, you want to end us since it's true?
Well, no, I mean, we started this a while ago when Dr. Tessia was here and had a great partnership with other entities, or whether they be state agencies or whatever. We started looking at this, and you know, unfortunately, Dr. Tessia moved on from DDA, and then we had COVID, et cetera. So I think it's time for us to start taking a look at this. When I say technology first, I don't think it needs to be like when we do employment first. When you go to a person-centered plan and say, okay, does the person want a job and should they be employed, and say, no, I don't want a job, then we just move forward. It's an initial question. I think with this, we've got enough people who are interested in technology that, you know, I don't think we have to start with saying that these are the guidelines. We want this basically answered as part of the PCP. So again, I think as we move forward on this journey with technology, enabling people to, you know, be more independent, use iPhones, iPads, etc., and adjust our waiver definitions, I think we can position this state in state of the art on technology and assisting people.
Thank you, Bernie. Really appreciate it.
So with that, I want to wish everybody a good, restful, and peaceful weekend.
Thank you, everyone.